morning, everybody. Just getting ready here to head into the hospital for a little breast reconstruction. But I was thinking about my cases for Wednesday, and I'm doing a big cosmetic case with Brazilian butt lift, fat transfer, liposuction, tummy tuck. And a question that came up with that patient that I thought probably a lot of people have a question is, do I need drains during surgery and after surgery? And if I do, why do I need drains? So I want to answer that real quick. Number one, so the reason we use drains in general is because after surgery, especially in plastic surgery, we tend to create large areas where we separate the tissue into layers. And normally those tissues are opposed to each other. There's no space there. But after we go in there, we create this new potential space. The body doesn't like that. The body responds to any kind of trauma by creating fluid and the inflammatory system kicking in. And that fluid now has somewhere to accumulate because we've now created a potential space. So for example, in a tummy tuck, we lift all of the tummy tissue, the skin and the fat, off of the abdominal wall or the fascial layer, which is the tough tissue that holds the belly together. And now that potential space is now a big reservoir for fluid to start accumulating. So if we don't do anything, the body's going to make fluid. That fluid's going to start to accumulate in that space, and eventually it's going to try to make its way out. And where is it going to come out? It's going to try to open up your abdominal incision and cause a lot of problems. So hence the reason that most of the time we do use drains for that type of surgery. What's called the no drain technique, which is something that I prefer to do for most of my tummy tucks. And in that technique, we're able to get away without using drains because essentially what we are doing is we are repairing exactly the problem that we created in the first place. We are slowly, starting at the top, suturing or using stitches to close down that space all the way till we get to the bottom where the incision is. And so essentially we've eliminated any dead space that was initially created. So by doing that, there's really nowhere for the fluid to accumulate, and so the body just kind of reabsorbs it. So for most of my tummy tucks, that's what I try to do to eliminate the need for drains postoperatively. In addition, the other great benefit is twofold. One is by using these progressive tension sutures, we're slowly distributing the tension along the whole abdominal wall. So by the time we get to the actual incision where we're closing it, there's essentially no tension on that skin. No tension equals awesome scar. The other thing is by doing that, we're actually slowly kind of stretching out the tissue as we make our way down to the closure, which effectively allows us to take out more tissue than normally we would. And the more tissue we can get out is usually the better, because that means more tissue that might have stretch marks, more tissue that's, we don't want the extra tissue there, because that's the whole point of the tummy tuck, is try to get that belly as tight as possible. So that's the answer to your question. That's why we need drains. But if you go to somebody like myself who is trained and learned techniques like no drain tummy tucks, then you may be able to avoid them yourselves. Obviously, every patient is different, and there are still some cases where I still may want to use drains, but that's something we can discuss when you come in for a consultation. So hopefully that answers the question for a lot of people out there. And please reach out to us if you have any questions. Arslanianplasticsurgery.com is the website. You can follow us on Facebook, also under Arslanian Plastic Surgery, and follow us on Instagram at Dr. Brian Arslanian. Thanks, and have a great one.